Hypertension, commonly known as high blood pressure, is a prevalent health concern affecting millions worldwide. It's often called a silent killer because it typically presents no symptoms, yet poses significant risks to long-term health. Understanding what hypertension is and how it impacts the body is crucial for early detection and effective management. Blood pressure is the force exerted by blood against the walls of arteries as the heart pumps it throughout the body. When this pressure consistently remains elevated, it signifies that the heart has to work harder to circulate blood. This continuous strain can damage blood vessels and increase the likelihood of severe health problems over time. Hypertension is diagnosed based on blood pressure readings which measure two key values: systolic and diastolic pressure. Systolic pressure, the top number, represents the pressure in the arteries when the heart beats. Diastolic pressure, the bottom number, indicates the pressure in the arteries when the heart rests between beats. To accurately diagnose and manage hypertension, healthcare professionals use a classification system that categorizes blood pressure into four distinct categories: normal elevated hypertension stage 1 and hypertension stage 2. This classification system helps individuals understand their blood pressure levels and the associated health risks. Normal blood pressure is defined as a systolic pressure below 120 millimeters of mercury and a diastolic pressure below 80 millimeters of mercury. Maintaining blood pressure within this range is optimal for cardiovascular health. Elevated blood pressure is characterized by a systolic pressure ranging from 120 to 129 millimeters of mercury and a diastolic pressure below 80 millimeters of mercury. While not yet considered hypertension, this stage serves as a warning sign indicating an increased risk of developing hypertension in the future. Hypertension stage 1 is diagnosed when systolic pressure falls between 130 to 139 millimeters of mercury, or diastolic pressure is between 80 to 89 millimeters of mercury. At this stage, lifestyle modifications and in some cases medications may be recommended to lower blood pressure and mitigate health risks. Hypertension stage 2, the most severe category, is diagnosed when systolic pressure is 140 millimeters of mercury or higher, or diastolic pressure is 90 millimeters of mercury or higher. This stage necessitates immediate medical attention and often requires a combination of lifestyle changes and medications to effectively manage blood pressure. The classification system for blood pressure, as outlined by organizations like the American Heart Association, is widely accepted and implemented in healthcare settings globally, including India. This standardization ensures consistency in diagnosis and treatment approaches, enabling healthcare professionals worldwide to effectively address hypertension. India, with its large population and increasing prevalence of cardiovascular diseases, recognizes the importance of adhering to these globally accepted guidelines. By adopting these standards, healthcare providers in India can accurately diagnose and categorize blood pressure levels, facilitating timely interventions and improving patient outcomes. This unified approach to blood pressure management underscores the global nature of hypertension as a public health concern. It highlights the importance of collaboration and knowledge sharing among healthcare communities worldwide in combating this silent threat. Untreated or poorly managed hypertension can have dire consequences for overall health, increasing the risk of a multitude of serious medical conditions. It's often referred to as a silent killer precisely because it rarely presents noticeable symptoms, making it all the more important to be aware of its potential dangers. Over time, the sustained pressure on artery walls caused by hypertension can lead to damage and weakening, increasing the risk of heart attack and stroke. The heart, forced to work harder, can become enlarged and less efficient, compromising its ability to effectively pump blood throughout the body. Hypertension also takes a toll on the kidneys, essential organs responsible for filtering waste products from the blood. High blood pressure can damage the delicate blood vessels in the kidneys, impairing their function and potentially leading to kidney failure. Additionally, uncontrolled hypertension can damage the blood vessels in the eyes, potentially causing vision loss. Understanding the potential consequences of uncontrolled hypertension emphasizes the critical importance of regular blood pressure monitoring, early detection, and proactive management. By taking steps to control blood pressure, individuals can significantly reduce their risk of developing these serious health complications and live longer, healthier lives. So check your blood pressure now. To continue watching such informative videos, subscribe to this channel.